Muscle growth anatomy. Skeletal muscles have epimysium, which is a connective tissue that provides the entire external protection of a muscle by having a dense irregular structure. It also has perimysium. Similar to the epimysium with its dense irregular structure, it is a connective tissue that covers every skeletal muscle fascicle and also divides muscles into fascicles and contains blood vessels and nerves. There is also endomysium, which is a protective external sheath of every skeletal muscle fiber. It has a loose irregular structure and contains nerve tissues and the main capillary blood supply for every muscle fiber within that muscle. There are also tendons, which are tough bands of inelastic, dense, regular fibrous connective tissue, and is located at the ends of all the layers of connective tissues that connect to attach bone to muscle. The origin is proximal to the body in comparison to the insertion and is the site of attachment that is stationary during a contraction. As well as this, it's usually a bone, cartilage, or connective tissue. The insertion is proximal to the body and is the site of attachment that is mobile when the muscles contract. Fasciculi. There is also fasciculi, which is a bundle of muscle fibers. And there is also blood vessels, which are networks of blood vessels in skeletal muscles that produce high amounts of nutrients, as well as providing oxygen to the skeleton, and also having high metabolic needs. Next, there is neuron control, which is mostly voluntary control with a stimulation that comes from the central nervous system. Each individual muscle fiber are connected by axons that connect through both the epimysium and perimysium to enter through the endomysium. And finally, fatigability. If the skeletal muscles are constantly being used, they will eventually tire, as lower amounts of force will be generated.